Yeah, second segment now. Dr. K, Dr. Kevin Kavanagh. He is a retired physician and also founder of Health Watch USA. Good morning to you, Doc. How you doing, Dr. K?
Doing good, Jack. Good morning.
All right, tell us about Health Watch USA. Last week we had a lot of people that were conspiracy theorists that were implying that you were getting money from different organizations for Health Watch USA. Tell us about Health Watch, what it is and how you're funded.
Yeah, we're a volunteer nonprofit organization. We're based in the United States and we're throughout the United States. And we're funded primarily by the board of directors. We're very careful not to take funding from government or from other agencies. And I think that that's important. We have no assets, no paid employees, and we are essentially a group of, well, I would say a lot of us are scientists or past scientists, retired professionals who gather together once a month on Zoom in order to discuss policy issues and to promote what we feel are good strategies with patient safety. And right now, our primary emphasis has been COVID-19.
Get any money from Big Pharma?
No, we get no money from Big Pharma and no money from Microsoft, although last time I did forget to disclose I do use a Microsoft computer. So that may count. But I also sit on a number of advisory committees or have sat on them, and all that would have to be declared also. So I really don't think those conspiracy theories hold much water.
Everywhere you go, there's controversy, and you just can't stay out of trouble. I understand you wrote an opinion piece for the Courier Journal that's got some folks talking. Will you tell us about that?
Well, it does, and it has to do with the decision of some of our elected officials not to be vaccinated because they had previous infections. And I think that that's a very unwise decision. Now, there was a rebuttal piece by Senator Paul stating that he doesn't need to be vaccinated because he has natural immunity. But I would put forward that, well, you don't know about these variants, and that's what is so concerning, is the immunescape variants which are overseas. And statements that there are no evidence of reinfections really is not true. Dr. Fauci testified before Senator Paul at a hearing in the U.S. Congress stating that in the Johnson & Johnson study, the South African variant, people who were infected by the wild type virus of COVID-19, that's the original virus, did not have protection. He stated no protection to infections from the South African variant. Now, to me, that's some evidence. That was submitted to the NIH, and that's very concerning. And that was further corroborated by reports out of Manaus, I believe that's how you pronounce it, the Amazonian capital, where they reached herd immunity, or supposedly reached herd immunity, back in the mid-2020s. I think it was in May or April. And they had 76% of their population they estimated to be immune. Well, they went on in December and just had another spike that just crushed the original one. And they concluded, and this was published in peer review literature, that this could have happened was with reinfections. And of course, the reinfections were being caused by the Brazilian variant, which also has this escape immunity mutation. So these are extremely disturbing. And to me, this means that we need to prepare because we need to be proactive, not reactive. We can't wait until we detect these variants on our shores simply because we don't even have a good detection system. And we've discussed this before. The genomic testing in the United States falls far behind other nations. And so vaccinations in the field appear to work. Natural immunity, not so much. And that's field observations. And so we do need to encourage those people who have had COVID-19 before to become vaccinated.
All right, Lane.
Sure, Dr. Kavanagh, I know like different entertainment places, here in Lexington and probably, I'm sure, abroad are looking forward to this June 11th deadline. What are the chances, though, that we might see some kind of resurgence when school opens and things like that? Are we looking for a whole year of going back to normal field trips and the like? What do you think, for example, next fall holds for schools and stuff?
Well, one of the problems with this virus is it's difficult to predict the future. It's kind of like the stock market. I've said that before. As you know, not everybody, but a number of people thought that this virus went away last September and we had herd immunity in all these places. And then again, everybody was decimated with another spike. So it's hard to tell. But with the variants and with the low rate of people who are vaccinated in Kentucky, we definitely are setting ourselves up for those occurrences. Now, school children, they tend to have asymptomatic infections, but they also do get the virus and they spread the virus. There are a number of studies which show that this can happen, especially in the older children. And there's at least one study out of Korea, and this was the initial study last spring, or that the group which spread the virus the most were the high school kids. So that is a danger, and that's one of the reasons why we need to be careful with schools. And also, as you know, and I've discussed this, is that we always seem to be talking about whether or not you live, and that's a pretty low bar for public health because these viruses can cause in a number of people a lot of long-term problems. And that, I believe, is one of the reasons why they're currently talking about canceling the Tokyo Olympics, because of the athletes. And I feel one of the problems that they're scared of is myocarditis in these athletes. So even though you may survive and you may live and you're not going to die, that doesn't mean this is something you want to get. I remember a time when people got diarrhea from a restaurant, they used to close down a restaurant. Right now, apparently, if you live, that's fine. And to me, that's not acceptable.
Laura, good morning. You're on with Dr. K.
Good morning, Jack. Good morning, Doctor. I have read an article on the internet, and I can't remember where it was from, maybe New York Times or Reuters or BBC, but it said that our CDC is stopping tracking data on breakthrough cases of COVID-19 after people have had the vaccine. It seems to me we really need that information going forward in case we get one of these variants coming in. I wish I could remember the article and tell you about it.
Well, yes, I'm well aware of it. And they're not completely stopping. They're only testing those people that are either hospitalized or have died. And most individuals feel that that is a significant mistake. We need to be testing everybody who has a breakthrough infection for a variant, because many of those people may just have mild to moderate infections. And as I've stated, those are still quite worrisome and can cause lasting damage. I should also note that we need to be testing approximately 5% of all specimens to track community spread. Right now, one of these variants can come into the country and spread, and we wouldn't detect it until it is too late. And I know we had one of the callers said, well, how are they going to come into the country with all these precautions? Well, I think most of our listeners would agree we don't exactly have closed borders in the United States. It's quite easy for these variants to come in. We need to get our guard up, and we need to prepare before they get here. That's what you do when you're in any sort of a conflict or public health endeavor, is that we have to prepare for the future, not react after a spike is already occurring.
Someone has written us an Auto Tech Service text line text. What is your opinion on why the CDC hasn't recommended that the U.S. border be shut down?
Well, I think a lot of it, and we've discussed this before, has to do with political pressure. Some countries have shut down all borders to everybody. We're talking about people that come in on airlines, come in on ships, come across the border, whether you're walking, swimming, it doesn't matter. You're a potential carrier of one of these dangerous variants. We have our cases now coming down low, so we could do case tracking if one or two areas popped up. But we can't deal with the flood of these variants coming in, especially when we don't have an early warning system. It can spread asymptomatically quite quickly.
And we're back with Dr. K, Dr. Kevin Kavanagh, 253-5959. That's our phone line and our Auto Tech Service text line. Dr. K, sounds like to me that there's a big effort underway to figure out how this virus got started. Now, it seems to me, and my memory's not that great, but when it started, the scientists, I think including Dr. Fauci and others, said that it was transmitted by probably a bat And the wet market there in China, there was no way that it escaped from a lab. Now they're saying there's a good possibility it did come from a lab. Why the change? Is this critical information that we need to know?
Well, yes, I do think it's critical information simply because if it did come from the lab, and from what I understand, there have been other instances of breakdowns and escaping viruses from that lab, we need to really fix the lab so it doesn't happen again. And I think that there's also just a problem with accountability. It's hard to prevent future occurrences of adverse events if you don't have proper accountability. As you can recall early on, I didn't really take a stance one way or the other. I said there's not enough information of exactly how it came about, but it is a dangerous virus from the Wuhan area. Myself, I'm beginning to feel like the evidence is mounting more on the side that this may have been an accidental escape from the lab. I have heard a number of reports. There have been a presidential information sheet out on this from the Trump administration. There have also been a number of scientists writing letters stating that we need more information. And one of the problems I've had is that they've never found the virus, at least to my knowledge, either in the animal market or in the suppliers of that market out in the field. And of course, you've got the problem of essentially a wall of silence and putting up barriers to the investigation, which furthers suspicion that something is going on. And so, yeah, I think that's something that really does need to be looked into. I think the Biden administration is following up on it. But I also think that if people weren't so anti-President Trump, this would have been done a lot earlier. You know, when you talk about the politics of the pandemic, most people just think you're talking about one side. No, I think a lot of politics clouded the judgment on both sides of the aisle.
Interesting. This is Leslie. Good morning, Leslie.
Hi. My husband had a heart transplant 25 years ago and is immune suppressed. Johns Hopkins came out with a study that transplanted patients' heart and lung are only 17% protected who have been fully vaccinated. I am a teacher. I was fortunate to stay home this spring, but am looking to going back to school in the fall. Are school districts going to offer a virtual for family members who are going to put their loved ones in jeopardy?
Well, I'm well aware of that study, and actually you're not even sure that that 17% is protected. I have a niece who has a heart transplant, and we are very concerned. The vaccines are not working in that group of patients. They also don't appear to work very well in the group of patients that have these chronic inflammatory diseases such as rheumatoid arthritis, inflammatory bowel disease, psoriasis, etc. And that accounts about 3 to 4% of the population. And so are we going to put that group at risk to this virus because we don't want to wear a mask and it's not going to affect myself? Even if I get sick, I won't have many symptoms. However, you need to realize that doesn't mean you're not going to spread it to others. And yes, they will be affected by the virus and are, I think, in danger. I agree with you that a hybrid or at-home learning needs to be an option. I think the same is with work settings. We're going to see more and more hybrid options. Some people really thrived under that sort of a scenario. And in a hybrid option, you kind of have both the best worlds, independent learning, independent working, and then at the same time, you get the interpersonal relations and reaction when you go back in and have your days back in work or in school. Some of the studies and businesses have found that production is up, costs are down, and so I think this is one of the ways the pandemic will transform our society. And that's one of the ways to the good. Also, I think we're still going to have curbside pickup on a lot of retail establishments. I'm sorry, it's more convenient to me. I can order a switch online at Lowe's, pull up, call in, and they bring it out to me, put it in my car, rather than trying to have to struggle and find it in the aisles. Still get it the same day, a lot quicker, less of a hassle. So there are things that are going to stay, and people need to embrace that. And if you see someone wearing a mask, for God's sakes, don't go up and be belligerent to them, thinking they're some, left-wing liberal. They may just have an organ transplant and need to wear it for their life, and you yelling at them close up may aerosolize the virus and cause them severe illness.
Well, you have a great weekend. We thank you, and we'll talk to you in a week.
Thank you, Jack.